Hi, my name is Jimmy Ninh. I'm Dr. Jimmy Ninh. I'm one of the neurologists here. And today I've been asked about the utility of the ANS1 pseudopath machine. So that's what I'm going to talk to you about today. So the great thing with the ANS1 machine is that it's a great screening utility. A lot of times we get a lot of patient referrals from family practitioners and internists about patients with vague neurologic complaints. They're passing out, numbness and tingling. And a lot of times we're not sure where to start out with it. Well, this is a great tool to screen these patients to see who's appropriate for more invasive testing. So what you're going to do is you're going to catch a wide variety of diseases earlier, and that's always a good thing, as you can treat it better and you can even prevent some of the long-term damage. And in patients who don't have a clear diagnosis, it helps to guide us as to which diagnostic tests we should do. Some of them can be more invasive, so it's great to have a screening tool to help guide us and how invasive we need to be for patients. So that's a great use of the ANS1 pseudopath machine. So as a neurologist, we get a lot of complaints for dizziness or lightheadedness. And sometimes it comes from the heart, sometimes it comes from the nerves, and it's really hard to tease out sometimes. A lot of the testing we have nowadays are inconclusive or they come back negative, and you're really not sure what to do with these patients. And quite frankly, we just didn't have the technology before. There are some older studies that we would do before, something called sympathetic skin response. It's basically evaluation of the autonomic nervous system, which helps regulate our body and keep our consciousness awake by blood pressure, heart rate, and things like that. The problem with those older tests is that sometimes they can be quite cumbersome to do, a lot of work to do them, and interpreting them is quite difficult. With this machine, it's good because it kind of makes it much easier for the practitioner to go ahead and do these tests. It does it very quickly in 7 minutes, and you get nice clear results to help guide you. And you use it as a guideline. It's not going to be a definitive test, but it's very good to guide you on where you need to send the patient, on how much testing you need to do. Basically, you're risk stratifying the patient. So you're going to affect a huge population of people with a very minimally invasive test. And that's why it's so good, and that's how it kind of relates to a lot of our patients. We have a lot of patients with Parkinson's who have lightheadedness and dizziness, and a lot of diabetic patients, amyloid patients with neuropathies, and sometimes they're very hard to tease out, but this is a great test for the family practitioner who doesn't know what to do with this patient who's coming in with 5, 10 very vague complaints. Well, if you're suspecting a neuropathy or a cardiac etiology and you're just not quite sure if this is an appropriate patient to send, you can do this test to screen for it, and you can risk stratify your patients, and based on that risk decide, hey, this patient needs to see a cardiologist, it needs to see a neurologist, it needs some further testing. And it really helps get the practitioner out of a bind and get them out of that rut where they're like, well, I'm not sure what to do right now. So that's very good for that. Another value of this is it's very convenient for the patient. The patient is much like going to your Walgreens and you're getting a blood pressure cuff. This is very similar. It's very complex testing, which is made very simple. It's basically a big, easy button to screen for these patients, and the patients like it. It's very easy for them. They get a rough idea of what's going on. When you get your blood pressure, you get a number, and you look at that number, and it gives you a lot of information. This is very similar. It gives you a lot more information about a lot more systems. So patients like this, and I would advocate it for patients. Right? Well, the bulk of it is going to be, everyone knows numbness and tingling, and they know that's associated with neuropathy. What may not be as apparent to people are things, skin changes in the legs, loss of hair, loss of vascularization in the legs. Dizziness and lightheadedness is a big component. A lot of it is related to cardiovascular as well as neurologic disorders. Those are appropriate patients to be screened for this. And in terms of neuropathy, someone may come in with vague complaints, and when it's what we call small fiber disease, it's very difficult to pick up, even with invasive testing such as EMG. Well, if we can catch these early on, it benefits the patient in that we can be more alert and be more cognizant of what we need to look for, red flags in the patients to see what's causing this. Not every neuropathy is caused by diabetes, but there's a lot of small fiber neuropathy out there which is difficult to diagnose. If we can risk stratify patients and we can catch the diseases earlier, then we can intervene earlier and try to prevent damage which may be permanent. The nerves grow back very slowly, but if we can find something, tell a patient, hey, you know, you have very early stages of small fiber neuropathy, we should do more testing, and then we find out they've been exposed to something, say, hey, you know, you've been exposed to something, something's not right, your vitamins are off, something like that, then we catch the disease earlier. And those will present to family practitioners as very vague complaints. You know, oh, I have a little bit of numbness, but it's not bad, I'm not a diabetic. You know, these are great tools for family practitioners to use to say, hey, you know what, well, we've screened you for this, at least on a preliminary basis we can follow you, but if we catch something, you know, we're going to catch it a lot earlier than we would otherwise. Some of the neuropathies can be reversed for sure. We have certain neuropathies which are what we call reversible, and we check for those things. But like I said, with this it's nice because you can apply this machine to a wider variety of patients. So you don't have to do all of this invasive testing, or you don't have to do all of these tests and, you know, scratch your head as to what the next step is going to be. Another thing is that, you know, these tests have been around for a while. What has not been around for a while is putting all of these tests together into one system which is easy to use and that you can do in 7 to 10 minutes. You know, a lot of these tests have been around, but you know, some of these tests can take an hour, 30, 40 minutes to do, and it's very technically difficult to do. It's very laborious. And this is a very quick and easy way to get those tests done with a similar amount of efficacy and diagnostic utility. The perfect candidate for this testing is anyone who comes in with vague complaints where you're just not sure about. Certainly anyone with numbness and tingling, anyone complaining of fatigue, lightheadedness for sure, stomach problems. You have to remember your autonomic nerves tie into your entire body, so you can have symptoms from GI motility issues to lightheadedness to fatigue. It's not just the numbness and tingling. And more that's what we're finding out. By the time they get to the neurologist, so many tests have been done. A lot of times they're negative, and you know, we're left scratching our head and just doing more tests. Well, this is a way to streamline all of your multitude of patients who just come in with these vague complaints. Hey doc, I'm not feeling well, I'm tired, I'm fatigued. You know, you're going to do the things like check TSH, you're going to check for anemia and things like that. Once that stuff is negative, and if it is, you're kind of left just holding the plate, and the patient is still asking you, why am I fatigued, why am I lightheaded? You know, this is where this test comes in, because it encompasses such a wide variety of etiologies for these vague symptoms that, you know, that to me is the perfect candidate. No physician likes to have a patient that they don't know what's going on, the patient's still complaining to them. You know, not all of these patients, you know, a lot of times they're kind of written off as psych patients, or they're fibromyalgia patients, or you know, it's non-organic disease. Well, it just means that we probably haven't found out what caused it. This is a great place to start. It may not give you the final answer, but it's a great place to start to guide you. So those are the ideal patients for this.